Okay, so now we are going to move into the wrist sprain. And then what we could do is shoot another one for carpal tunnel. So we'll get back to that. So this will be completely for just the wrist sprain, which can be a number of reasons. Obviously, slips and falls, very common. Even if you get fractures in the wrist or fractures in the hands, and using the tape for fractures is beautiful. It really does help if they're not casted, and then you can apply the tape. So what's another one? I've seen people having to use canes, and the pressure on the cane creating the radius and ulnar slight separation and irritating the tendons. And so just giving it that compression in there with the tape just alleviates, like, almost immediately the discomfort. And then obviously excessive use. Believe it or not, now with technology and phones and excessive computer use and technology especially, I'm finding a lot of wrist and odd thumb pain where there's, I don't know what's going on. I don't know how it happened. So then I end up finding out, or they literally will walk over to their phone and immediately pick it up. Yep. So those positions from texting or emailing from phones, see it a ton, and that can really help. So I tell them to switch to the swipe. So it's like this, and they can swipe their words. So that's good. Okay, enough with that. So with this, we can use full strips, or basically the length of the arm is always fine to judge off of. And you can do this basically in a neutral. So you can do it this way. You're going to end up moving this around to help you with the tape. People do this different ways. I tend to find the easiest and fastest way to do this while working, or when you're, like working on a neighbor or something, is to rip it through, pull it slightly, and just give it a little bit of a slight, like 20% pull. With this, what we're going to do is I'm going to do half the tape, bend a little, half the tape here and half the tape here. So we're overlapping that whole joint. Like so. And then what you want to do is if you can, slightly angle it without getting too many folds. Like, so this one wants to angle up the hand a little. And sometimes I put that in my mouth like that. Or I just toss it aside. And then this one wanted to go that way. So I kind of found the feeling of the tape fibers to not have the tape, again, end on the tape, because it lasts and stays longer when you get the tape to end on skin. Okay? So if this feels good, which typically does, sometimes you can do another one. Or if they say, I'm having discomfort when I go this direction, or I'm having discomfort when I go this direction, you're going to want to tape in the opposite. So let's say she has pain when she flexes down. So what we want to do is we want to slightly restrict her going into that full movement because she's creating that pain. So again, this can be done in the opposite direction, which you would tape here. So if she had pain when she went this way, what you would do is you would bring it into the opposite movement where there isn't pain, and you could put a piece of tape here, first or second. I'm not a big person that some people really care about this one goes first and this one goes second. Let me tell you, once you sometimes get that tape on there, it really just helps. So let's just do this one. If she has pain in that direction, I'm going to have her go into not full, just, about 70, 50% in that direction. I'm going to change colors, and you can use the pre-cut for this, or you can cut it in half. And let's show you you can do either. It does not have to be the full, especially for a teenager or a small adult or a child. So I ripped it, I've opened it, and now I've grabbed it like this, just to show you. I'm going to show you that I've got thumbs pinching with the forefinger, and I'm going to give it a slight pull. Go ahead and bring that into extension a little bit more. And then I'm going to attach here first. Okay, it's just to show you, I've got it attached to where, I'm going to twist you a little. Hopefully that doesn't hurt too much. I've got it attached right above the, now I'm going to go onto the black. I'm going to give it a slight pull, and then I'm going to take it across and attach it there, and then have it release and have her release into a little bit more comfort right there. And then there's no tension here on that, and there's no tension here on that. And then you can, some people like to use the back. I've never been a fan of that. I just think sometimes, I mean, we're in Florida, so everybody's kind of hot anyways, body temperatures, but you know, some people's circulation isn't good. And then that would slightly, you could see that even if she relaxed and tries to go into that flexion, it pulls. So there's a slight restriction in that, and that will definitely help pain with this motion. And just to recap, if she had pain with this extension, you would tape it in a slight flexion this way and do the opposite direction. So this would feel really good and help this heal faster.